Welcome to The New Health. I'm your host, Jessica Preston. In The New Health, we speak with thought leaders and innovators in healthcare who are making changes in the world. Today, I have with us James Maskell. He's a health economist who has spent his life learning about healthcare and chronic disease, and now is working to build a sustainable healthcare model. He's written 2 books, Evolution of Medicine and The Community Cure. We're going to discuss that today as well. Welcome, James.
Great to be here with you, Jessica. Thanks for having me.
Happy that you're here with us.
Yeah.
So tell me a little bit about the evolution of medicine and how you ended up in this space and your background.
Yeah, so I actually was trained in health economics at university. I went to university and I grew up in England. I was born here in America. And in that training, I recognized that in my lifetime, not just some great time in the future, but I recognized when I was having kids or when my kids were growing up, that we would face a calamity in America and in the UK, where essentially the cost of chronic disease would be so giant that neither economy would be able to contain it or support it. And I just recognized that this was not some far off problem. This was going to happen in my lifetime, and that ultimately, I had grown up with a different model of healthcare that no one knew about, and I just started on a quest. I guess at that moment I left the UK where I grew up. I quit my job as an investment banker and I moved to America to really understand what are the drivers of chronic disease? How do people get chronic disease? Is chronic disease reversible? And then being on a journey since then to think, now that I know that it is reversible, how do you do it at some meaningful scale that could take a bite out of that problem?
Yeah, that's wonderful. So I know we had talked a little bit earlier about acute versus chronic disease.
Yeah. That was really the evolution of medicine. So the medical system that we have now, even though many people see it as problematic, it was a reasonable way of delivering care at the first part of the 20th century. And that's when the majority of disease that you would see was acute in nature. So infection, physical trauma, accidents, those were the things that were killing most people. And as a result, you have this whole health system that gets built. And some of the things that we just think about are the way things are just a reflection of what the diseases were at that time. As an example, why do you see the primary care doctor first? Why do you see the doctor first? The reason you see the doctor first is that when someone comes in and there's an acute issue, time is of the essence, and you need a doctor who's going to identify what's going on in this patient as quickly as possible and come up with a solution as quickly as possible because of the acute nature of the problem, right? And so many other things come as a result of that. All of the insurance billing, the coding, the referrals to specialists, even physician specialization, all of that comes downstream from the fact of those are the kinds of diseases that we see. Then in the 1950s and really through until now, you see the growth of chronic disease, mainly lifestyle-driven chronic disease. And because the way that these diseases come about, the etiology of the disease, why people get them, how they come about, how long they take to happen is completely different. You end up in a situation where the medicine is not fit for purpose, right? And so the idea of the evolution of medicine is that the medical system needs to adapt to the new environment. And the new environment is chronic disease. And so I would say if you take a step back, what I've been doing for the last 20 years is understanding chronic disease, how it comes from, where it comes from, and then started to think, if you were just to start again and you were able to really think about how to do chronic disease, how would you do it? And then once you understand that, then start to think, okay, how can the medical system best adapt to this new environment? And in the Evolution of Medicine in the book, it was really written for the physician. I wrote the book so that I could hand it to a physician and say, read this, and if at the end of the 3 hours that it took them to read it, they would want to be part of a revolution. That the tagline was, join the movement to solve chronic disease and fall back in love with medicine. And I think we've helped thousands of doctors across the country go on that journey, and that's the sort of beginning of this evolution.
That's wonderful, and I've read the book, and that's how I first learned about you, and I joined the movement. Now I believe this is where the 4 Ps for medicine would come into play?
Yeah, the P4 medicine is an interesting concept, and it's a good way for people to grasp what I'm talking about. This is actually popularized in Silicon Valley in some ways. They were talking about, what does this new medicine look like? What does this new health look like? And ultimately they called it P4 medicine. And P4 medicine, I'll just go through the 4 Ps. The first and most important P is participatory, right? All the other Ps are less important than the first one, which I think is participatory, which means that in the new medicine, people need to actually participate in their care. Again, in the old days, if you get an infection, you don't really need to participate. You just need to take the antibiotic, right? That's all your participation. But if you have a lifestyle-driven chronic illness, a fundamental truth is that you're going to have to participate to reverse it. So that's the first P. The next P is predictive, right? You can actually predict future disease. There are ways that you can predict future disease. And ultimately, a lot of the work and the doctors that I work with is about understanding that before you get not just diabetes, but Alzheimer's and stroke and autoimmune disease, before you are in that category of having the disease, you can predict that you are going in that direction, and you can stop and go back in the other direction, right? So it's predictive. Preventive, right? So that you're actually preventing future disease by taking action now. That's the third P. And then the fourth P is personalized. And so much of medicine is not personalized. So much of medicine is medicine for the average, and this is medicine for the individual. So P4 medicine is the sort of ideal of what we're going for. I called my show the Functional Forum, and I went into functional medicine because I believe that functional medicine is the best way today to actually practice P4 medicine. P4 medicine is a concept. Functional medicine is an actual operating system that doctors can actually learn and actually deliver today, and that's why it's been a central part of my platform.
That's wonderful. So you are our first guest on our first episode, so I would love if you would give us a definition for functional medicine for us.
I mean, the easiest way to think about it is, medicine, as I described, the old medicine is medicine by symptoms. You have this symptom, the doctor works out what the disease is, and then gives you the drug. I mean, that's basically the way that it was. Functional medicine is medicine by function. Over time, you don't just suddenly get a chronic disease. The body is functioning normally, and then suddenly the function starts to dissipate in one or more areas, one or more systems, and over time, if it gets worse and worse and worse and worse, then eventually you have a symptom, and the way back is not to treat that symptom, the way back is to rebuild the function. It's as simple as I can say it.
Okay, and we do that through, and I know you mentioned lifestyle before and chronic disease, and I think that has been lost over time. The connection between chronic disease, as you said, it develops over time slowly, so we can't reverse it in a day. We didn't build it in a day. And that is very much based on how we live our lives.
Yeah. Lifestyle is the foundation always. So lifestyle, how we sleep, how we eat, how we take care of each other, how we love, how we take care of our stress, all of these, how we nurture in our environment, how we create a healthy environment in our home, in our workplace, all of that is the foundation. And, lifestyle is critical. However, what functional medicine, the sophistication of the functional medicine model, is that there are ways to tell what function has gone down in which organs and systems, and then rebuild specifically. And that's one of the unique things about this new paradigm, is that you can have 10 people with type 2 diabetes, and you can actually go back in their history and you can look at their function. You can see 6 of these people got type 2 diabetes because mainly food. 2 of them got it from mainly toxins in the environment that mess with the insulin sensitivity, and 2 of them got it from excess stress. And it's always combinations of those different things. But if you look at it if you look at it from a personalized understanding and you see why people got there, then you can work out how to reverse it. And that is the work that doctors are doing in communities all around the country right now. And part of the sort of the end result of the evolution of medicine and many others' efforts is that in every little town across the country right now, there is a functional medicine doctor that is in the business of restoring function.
And you're a part of that mission, and I'm so excited about that. I'm so happy that you brought that forward for us. So tell us a little bit about Community Cure.
Yeah, so the Community Cure was just really the next step in that journey, which was that I recognized that in functional medicine, we like to communicate that this is the root cause, right? That we like to deal with the root cause, the root function issue that I mentioned earlier. A lot of times, the root cause is a lack of community, right? Is social isolation and loneliness. Loneliness, people who are lonely have a between 20 to 40% higher risk of the biggest killers. Alzheimer's, heart disease, stroke, diabetes, loneliness plays a key role in there. And not only is the loneliness bad for you, but actually the structures that most people need to do new healthy behaviors is also community. And the community cure was really written as a way to think about the way that I could see that medicine could actually, it's a different question. So in the evolution of medicine, it's like, is chronic disease reversible and how can it be reversed? And right now we see that you can go to a doctor trained in functional medicine and they will help you reverse your chronic disease. But as an economist, there is something wrong with that equation, which is that that can't work for 330 million Americans. That can work for maybe the top 10, 20, 30% of society that can afford to go to a doctor, that can afford to practice in that way. What are we going to do for everyone else? And what I came to understanding, and the reason I wrote The Community Cure, is that there was an emerging way of practicing this functional medicine where people were actually treated in groups, in cohorts. And through those cohorts, people were doing these healthy lifestyle behaviors, were improving their function, but were actually creating new friendships around people who also wanted to get healthy. And that, I believe, is the foundation for a truly scalable, truly inclusive new healthcare system.
Thank you so much for that, James. Well, how can people reach you, get in contact with you, learn about what you're working on right now?
So on my website, jamesmaskell.com, you can see the different projects that I'm working on, that I'm involved in. And, I have been, involved, I am currently involved in a number of projects all around the same mission. And then I'm most active on Instagram, Mr. James Maskell, and you can find me there and see what I'm doing day to day, and love to connect.
Oh, that's wonderful. Thank you so much. So thank you so much for joining us. James will be back with us next week to speak with us more about his work and how he is revolutionizing healthcare at this time. And come back after these messages and for our next guest.